Hi, my name is Rachel and I'm here at Hair Restoration Specialist in Atlanta, Georgia. Today we're going to be doing an Elite Platinum No Shave FUE, which is where we are going to go in throughout the back and sides to extract follicles without shaving anything to place up top. The procedure we're doing today is filling in the hairline mostly and then a little bit in the vertex as well. We are expecting anywhere between 1,500 to 2,000 follicles, and throughout this video we will be showing various portions of how the procedure is done. The drawing of the hairline, extracting, placing, and then afterwards as well, so you guys can see everything. So let's get started. Before starting the procedure, we take the patient's vitals to make sure that everything is looking normal that morning. And then the team goes over the medical history once again, answer any last minute questions you may have before we really begin. After that, we draw the patient's blood. This is to use PRP during the procedure. We take your blood, separate the platelets from the rest of the plasma nutrients, and then spin them down in a device called a centrifuge to highly concentrate them into a very small amount of fluid. Your follicles will be soaking in your own platelets, which are the growth factors in the blood that stimulate cell growth and cell reproduction. And this is to allow for the most viability and best success rate for the grafts. After the blood is drawn, we review the donor area again, aka the back and sides, to fully plan and map out exactly how many follicles we think we're going to be able to get out, and to make sure that we know exactly the size and area that we're going to be filling with those follicles. So in this case, we are filling in the hairline and some in the vertex. So we measure it out, go over with the patient again, show them exactly where the hairline is going to be placed, make sure that they are fully happy and understand exactly where we're going to be putting things. After the hairline is drawn and everything is set up, we then administer the sedative. So we give the patient Valium. This is to fully relax them during the procedure. Just make sure that they are as comfortable as possible during the long day. We lay the patient down, and this is how they are for the first half of the procedure, which is where we are extracting follicles from the back and sides. So having them laying down is to give us the best access and visibility to the follicles. The first thing we do once they are laying down is we then administer the local anesthesia. This is the lidocaine mixture that numbs the scalp so that the patient does not feel anything during the procedure. So the entire day you are numb and you are relaxed. Most people actually end up falling asleep and sleep through a lot of it, but even if you don't, we do have TV and music to keep you entertained throughout that entire day. Once we have gotten the patient situated and started, we start by creating the extraction sites, which is where we are taking the follicles out of the back and sides of the scalp. This is where the tiny little holes are hollowed out, and the follicles are then extracted with the tweezers that you are seeing here. We use the WAH system, which is one of the many devices that is available to perform FUE procedures. This is the device that we have had the best results and just yield the best success rates overall. As you can see, there is a team of people working on you collectively, led by our doctor and a team of technicians. This is because this is a very tedious and delicate process, and it involves a lot of work and a lot of hands to get the best results. As the follicles are extracted, they are then put into petri dishes and sorted out. And we always check under the microscope to make sure that the follicles are healthy, that nothing has been transected, and that they are the best follicles to yield the best results. As they are placed in the petri dishes, and once they have been checked under the microscope, they are then sorted and counted. Hair follicles can have anywhere from 1 to 4 hair strands in them, so they are sorted and counted that way. And that way we can know exactly how many follicles we're getting out, along with kind of how many hairs we're expecting to get from the procedure. This is what is done during the first half of the procedure, which is where we are extracting and counting. This takes anywhere from 3 to 4 hours, and that's kind of the first half. It really depends on the day exactly how long that takes, but once this process is done, we do provide the patient lunch, and you can get up, they go to the bathroom, kind of walk around, take a little break just to make sure they're ready for the second half. Before we start actually placing in the recipient area, we do just reconfirm with the patient that they do understand and are fully happy with the hairline. So as you can see here, one of the technicians is showing the patient the mirror, just going over everything again to reconfirm that he is fully happy with everything we're going to be doing. As you can see here, throughout the procedure, more lidocaine is then administered to make sure the patient is numb while we are placing the follicles that have been extracted. The second portion of the procedure is where we are actually placing the hair in the recipient area, the area of loss that we're filling with the new follicles. Each individual placement site is created with a punch, as you can see we're doing here. So we're creating a little incision, which then the follicles will be inserted into those sites with the small little tweezers. This portion, again, typically is another 3 to 4 hours long, and it is done by the team led by the doctor because it is tedious and very detailed. We are filling in the hairline, filling in the temples, and then also a portion in the crown as well. And we really pack it in as dense as possible to give you the thickest appearance overall. Once the procedure is done, meaning all the follicles have been placed and we have cleaned the scalp to make sure that the patient looks okay to walk out the door, pictures are taken, and this is for your chart so that we can monitor as we go on in the future to compare the before and afters later on. Once we are done with the procedure, we apply ointment, clean up the patient to make sure they look suitable to leave, and then review the post-op instructions with them again to make sure they understand what to do that night, answer any last-minute questions they have, and then we send them home, typically via Uber, and they will then sleep at home that night. Now, we do provide some antibiotics and sleeping medications to help if they are uncomfortable. But the following morning, we do like to see the patient back very briefly just to wash their scalp. Again, go over the post-op instructions, answer any questions they may have, and allow us to thoroughly clean any remaining blood. With this procedure, it does take upwards of a year to see the full results. After that first appointment the following day, we do like to see patients back 30 days or a month after to check in, just make sure they have healed, everything is looking good, that they're not experiencing any irritation. This patient actually did just come in for his 30-day appointment, and we can add photos in of that so that you guys can kind of see what it looks like about a month after. And then after that 30-day appointment, we follow up with patients every 3 months after that to make sure that they are on track, the growth is coming in as expected, and then at that year mark, we have a final evaluation to make sure that they are fully satisfied with everything that's come in. Thank you for watching our video on a procedure for a transplant. If you have any questions and want to learn more about how we can help you, give us a call at 404-231-3100.